It's estimated that a third of the world's population is actually infected with the tuberculosis organism. It's a very serious condition which is fatal if not treated. There are about 2 million people with active tuberculosis in the Western Pacific nations surrounding us.
If we don't control tuberculosis on our doorstep, within our region, tuberculosis has the potential to re-emerge as an issue for us in Australia.
Tuberculosis is a real tragedy, but it is a tragedy that can be fought. It's a tragedy that can be prevented. It's a tragedy that can be combated, and Australia is very much there playing its part.
These sorts of issues always have bipartisan support, and we're happy to lend that support.
I was diagnosed in 1995, and so I was 26, but I suspected I'd had it for a few years. It was an extraordinary struggle. Awareness of a preventable disease is really, it should be at the pointy end of any conversation.
Tuberculosis has not gone away. Globally, almost 2 million people die from TB each year. In our neighbouring countries, including Papua New Guinea, Timor and Indonesia, TB is a major killer. It's a curable disease, yet it remains one of the greatest preventable causes of death on the planet.
In underdeveloped countries, it's a poorly treated disease often because the surveillance of patients who might have active tuberculosis isn't as good as it could be, and then treatment is not as well organised as it is in countries that have more resources.
Treatment of multi-drug resistant TB, or MDR-TB, is a major focus around the world. Effective treatment requires early detection, followed by a course of antibiotics. Patients with regular tuberculosis need to stay on medication for at least 6 months, while those with MDR-TB require at least 18 months treatment. Medical supervision is essential, but this is a challenge for patients in developing nations.
The resources aren't there in order to conduct those sorts of treatment regimens.
Australia is helping reduce the burden of TB in neighbouring regions by providing resources and extensive education and medical training programs. Leading NGOs, such as the Australian Respiratory Council and the World Health Organization, are working alongside corporations like Lilly Australia to make this happen. And of course, the Global Fund plays a vital role in the fight against TB.
The Global Fund is currently saving about 3,500 lives every day. More than 2/3 of the funding for TB programs in the world come from this one single source. So without that source, the fight against TB would be in serious trouble.
The Global Fund has been responsible for the treatment of almost 8 million cases of tuberculosis around the world. So we're very proud to have significantly increased our commitment to the Global Fund, $210 million over the next 3 years.
The Coalition believes very strongly that the government deserves bipartisan support, and it continues on the work that we did when we were in government.
So on World TB Day, are we doing enough to help our neighbours combat this immense health problem?
I think we have a long way to go in getting the tuberculosis epidemic under control. I think we've made huge strides in helping healthcare systems in the developing world understand what they can do to manage their patients who have tuberculosis, but a lot remains to be done.
If we are serious about combating tuberculosis and fully supporting the Global Fund to the amount that's required, Australia needs to commit $500 million in this current replenishment.
I think we can always do more. A desirable goal would be to control tuberculosis worldwide as well as it's controlled in Australia. We need to put more resources into the detection and surveillance of populations where TB is much more active.
I would never like to see someone go through what I went through. We have, an obligation as a wealthy nation to look after our neighbours in regard to a whole range of areas. But TB can be treated, it can be dealt with, and we can stop people dying unnecessarily.
And the world needs to act on this, because if we engage in action, we can prevent so many of these deaths. The government is very much committed to that, but it's important that continues, and of course that only continues with the support of every Member of Parliament.